Traditionally, joint replacement surgery has been about getting rid of patients' pain, whereas now what we're trying to focus on is not only getting rid of their pain, but also improving their function.
It's impacted my life immensely because I couldn't drive and I couldn't walk much more than minutes without pain. And it is, like I say, it's only a few weeks after I've had it done, but I'm in no pain whatsoever at the moment. I do walk quite a lot, especially on holiday. It's like a big thing to us, is just go for a walk and go to the next town, get a drink and just walk about. And I have done that this last couple of times when we've been on holiday, but I couldn't do that before.
So I'm James Haynell, I'm a consultant orthopaedic surgeon. I specialise in hip and knee replacement surgery, and in more recent years I've had a real focus on joint replacement surgery with the benefit of using the robots.
My name is Brian Laban. I've had a total knee replacement at the Yorkshire clinic. I've had problems with my knees for probably 10 years. I've had 2 keyhole surgery on them both. I've been taking painkillers for years, but it just got worse to the point of I've been having steroid injections in both my knees lately, over the last year, and I just couldn't stand pain anymore. So I went to my doctor to ask him about a total knee replacement and recommended the Yorkshire clinic. It's impacted my life immensely because I couldn't drive and I couldn't walk much more than minutes without pain. I lived on painkillers, and I mean, I took painkillers at night. But since this week, just to show you an example, is I drove to Bristol and back in there, and again I can't walk normal, which I could never, no way of doing that. And it is, like I say, it's only a few weeks after I've had it done, but I'm in no pain whatsoever at the moment. I chose the Yorkshire clinic, as I've said, I have been here before for an arthroscopy, I believe they call keyhole surgery, and I was highly delighted with Yorkshire clinic then, so it was a bit of a no-brainer really. Originally, when I was going to get the surgery done, I did like most people do. I went online and started looking at what procedure it entails, just to sort of see, get your head around it. And online there's quite a lot, especially American YouTube videos showing you robotic surgery. So when I came and I saw Mr. Haynell, he recommended it. So again, I just said, yeah, I mean, he does inspire with confidence as Mr. Haynell, so I just said, yeah, I'll do whatever you say is best, really. So
the robot assists me in surgery by putting some temporary pins into both the thigh bone and the shin bone. So the robot has a very, very accurate eye, so it can see exactly where the bones are, and therefore can assess the position and also the gaps between the bones as well. We then use probes to map the anatomy of the patient's knee. So again, we can then accurately place the implants into the knee so that we can improve the gaps and positioning so that their long-term functional outcome can be improved. The day of the surgery, I believe I came in at lunchtime and I was programmed to go down at 1:30, which all went sweet, put you in the room, get changed. And I woke up and you don't think, you think you're still just going to surgery. I didn't realise I'd had everything done. They take me up to recovery. Within, I think, hours, you're getting out of bed and walking. In terms of the difference between recovery of a robot-assisted knee replacement and a traditional knee replacement, I think you'll find that the short-term recovery is very, very similar. We do knee replacements traditionally really well already, but this is the intention of doing them even better. So what we're looking for really is the long-term functional difference. So the ability to get back to playing sports, playing tennis, going for long walks, the feeling of stability within the knee. And that's why we're doing this. Recovery were, like I say, painful at the beginning. Now, 8 weeks, I'm walking no pain, it's brilliant. I have been on holiday since, and I've enjoyed my holiday more. You can go for a walk now in sun and walk on a beach, and I couldn't do that before. I stopped in a hotel and round pool because it was so painful. So as well as having the benefits of the robot assisting us making those measurements and making the cuts, we also use our experience in terms of actually putting the knee replacement in what we would consider to be a successful position, and also by having the personalised positioning of the implants according to the patient's own anatomy and soft tissue tension, that will lead to a knee replacement that is functionally much more stable and feels more like their own natural knee.
My experience with Yorkshire Clinic, what really, it was 10 out of 10. It was faultless. I think everybody, full team, starting from Mr. Hernal, were absolutely brilliant with me. It was a really big team effort, and everybody makes you feel welcome and safe, and they do give you confidence. I do have to have the other knee done, and I will definitely come back and have it done again, and I will definitely ask for Mr. Hernal.
Okay, so following robotic knee surgery, you'll be working very closely with the physiotherapists to get yourself back up and getting you back to your normal self.
I've been every week for 8 weeks, and if not seeing Mr. Hernal, I've been seeing a physio team. And again, they were all telling me what if it wasn't bending as good as what they expected, they were telling me why, telling me to do more of this, more of that. And everybody would have it was just full of confidence, and like I say, it's worked what they've done for me.
By 2 weeks following surgery, it would be expected that you would be walking independently at home, so you'll be starting to drop the use of your walking sticks around the house. And then by 6 weeks following surgery, for most patients, they are free of their walking sticks, and they're really starting to improve their mobility. In terms of the long-term outcome, we would expect the majority of patients to have a pain-free knee by 1 year following surgery. So one of the things I really love about doing joint replacement surgery is when patients come back to me a year following their joint replacements, and they tell me all the things that they've been doing and that they've got back to, and how they just forget about having a joint replacement. And that, for me, gives me a real sense of satisfaction. The more that you do, generally the better the outcome of the knee replacement would be. And I've had patients who've cycled from Land's End to John O'Groats, who go off on their golfing holidays. I've just had one of my ladies who's won a national competition for golf only 3 months following surgery. So, you know, joint replacement surgery really does get people back to doing the activities of life that they've enjoyed prior to having arthritic change.
I think the procedure's changed my life, really. I know I may be repeating it, but when you've took painkillers for 10 years and now you're not taking them, it's a big thing to me, is that? And I feel a lot younger. I just feel like, you know, I can do more in my life now. I felt like I was getting old before because I was limping. My total leg and my hip were giving me pain. So it has changed my life, yeah. It does make you feel older. You can see yourself sometimes in the mirror and think, I'm limping there, and I just look. And just before I had it done, I did actually I got a walking stick off a friend. And everybody says, God, Brian, what's up with you? You know, like you look 10 years older. Yeah. But now you know, like I say, I'm back to how I was before to me. Yeah. So it does make you feel a lot younger, yeah, definitely.